It is about you, like the whole person, right? Whether it's your hormone, your physical health, your behavioral health. That's how primary care should be practiced. And oftentimes we talk about like good old days, our family doctor. We think about in the good old days in the village, you have a family doctor, you know that person's first name, they know your first name, they know your family history. That's what primary care should be, that relationship, that knowing all of your family history, knowing that what you're dealing with in your life right now, that impacts, right? Like all the symptoms that you're experiencing. That's how we think about primary care.
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
Our guest today is Gloria Lau, co-founder and CEO of Hello Alpha. With a mission to improve access to women's healthcare, Gloria brings over a decade of experience in data science, machine learning, and AI from her time at LinkedIn, Google, and at Stanford University, where she serves as consulting faculty. Gloria's unique perspective stems from her personal challenge in navigating the complex U.S. healthcare system, which inspired her to create Hello Alpha. Her work is transforming women's health by providing affordable and comprehensive virtual primary care. In this episode, we discuss Gloria's journey from technologist to healthcare pioneer, the challenges she faced in founding Hello Alpha, and the impact of her work on making healthcare accessible and affordable. Here's our conversation. Well, thank you, Gloria, for joining today.
Thank you for having me, Christine.
I'm so excited to have you. I've been watching you progress, and I felt that you've been knocking every challenges, every brick in front of you. And I thought that's really amazing what you've done. And I really want to share your story with a lot of our listeners. And I always like to start with your journey, your personal journey, what takes you to where you are today, and how you navigate all this, left turn, right turn. Oftentimes our journey not straight line. So
cool. Happy to talk through all of these, and thank you for having me here today, Christine. My founding journey, it's actually a very classic Silicon Valley. I had a women's health issue, and it was beyond frustrating, my own patient journey. And I didn't come through a healthcare background. I'm a technologist by training, machine learning, data science, AI. That's my background. When I had the women's health issue, I was bounced around from primary care to OBGYN to two more specialists. And it was just, one, it was very uncomfortable. And two, it's hard to traverse. It felt like I was my own quarterback as the patient. I'm also immigrant, by the way. I grew up and was born and raised in Hong Kong, and it's a single-payer healthcare system, a lot simpler than the healthcare system.
For some reason, nobody wants that here.
Sorry about that. So that adds to my frustration. I just felt like it shouldn't be this complicated. It shouldn't be, I shouldn't not know how much it's going to cost before I go in, right? And my bounce around actually cost a lot of money because there's multiple specialists. It took about 2 months to resolution. At the end of the day, I got prescription steroid. I felt like I wasted a lot of time, wasted a lot of my own money, my own copay, my own deductible, and my payer have to pay tens of thousands of dollars for that episode. So that was how I got started in healthcare. So at that time when I had the issue, I was at Google, decided to quit Google. That's why I say like classic Silicon Valley story. Decided to quit Google and like figure out healthcare. However, I had no healthcare background. So during that time, I went back to Stanford. I'm a consulting faculty at Stanford, so it's easy for me to hang out there, speed learn healthcare, just like talk to lots of people, met my co-founder in the medical school and started Hello Alpha. So that's the beginning of what you see today as Hello Alpha.
Yeah, it was interesting you mentioned that many of us probably have a lot of similar experience as you, but not everybody decided to tackle this. And what were the drive?
I think I was just beyond frustrated with the navigation, with the lack of training in the providers that I was seeing. That was like one of the main reasons. I was just like so frustrated. I felt like it was unnecessarily complicated. I felt like the other thing was, I felt like if I don't fix this, who's going to fix it? At that time, this is a little bit more context. I mentioned that I'm immigrant. So at that time, I haven't naturalized. I have a Hong Kong passport. And I felt like, well, like if anything happens to the US healthcare system, I can always escape back to Hong Kong. But I have 2 kids. They're American and American only. They have 1 passport. So they have nowhere to escape. So that was part of what I felt like, gotta fix it, if not for myself, for my kids at that moment. By now, I've naturalized too.
Yeah. So you mentioned about the lack of training. What do you mean by that?
Yeah, so my own journey, unfortunately, that's very commonly shared by a lot of women. It's the fact that when you go into a primary care provider, anytime you talk about anything that reminds them of the reproductive system, chances are you get automatic referral to OBGYN, which was what I got. But it shouldn't be because, one, a lot of the issues that we deal with are fundamentally primary care for women. It's everyday healthcare. But because of the lack of training in medical school, that's why the automatic referral to OBGYN, because primary care just isn't trained, equipped with dealing with things like heavy bleeding, menopause, endometriosis, PCOS, right? So that's that automatic referral that I receive personally. When you get to the OBGYN's office, chances are they don't want to they don't want to see you for things that's effectively primary care, that they cannot cut up because it's primarily a surgical discipline. If they can't cut me up, they're not practicing at the top of their license, right? So it's not their fault, nor the primary care's fault, right? It's just like this lack of training, this gap in between. That was my own patient journey to bounce around. And that's what I felt like if my primary care provider were just like a little bit more knowledgeable, I didn't have to go through this journey. So that's what I meant.
Is it correct assumption to think, I feel like now the primary care role is almost like the fancy version of people who are telling you where to go. It's more like, well, you have this problem. It comes from your uterine, so OB-GYN. It comes from your eyeball, go to ophthalmology.
That is a good way of putting how it's used often. Like lots of people use primary care as traffic control, like just routing you to the right lane, right? We think that primary care should truly be a much better way of traffic control, right? Like if we can resolve the problem here, there's no reason for me to route you to OBGYN or blah, 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 right? Like primary care fundamentally should be your first line of defense. It should resolve your everyday medical issues. It should manage your whole health, right? Like your physical health and your mental health together. It is not about a organ, right? It's not about like, if it's uterus, I'll route you to OBGYN. That's not what it's about. It is about you like the whole person, right? Whether it's your hormone, your physical health, your behavioral health. That's how primary care should be practiced. And oftentimes we talk about like good old days, our family doctor, right? Like we think about in the good old days in the village, you have a family doctor, you know that person's first name, they know your first name, they know your family history. That's what primary care should be, that relationship, that knowing all of your family history, knowing that what you're dealing with in your life right now, that impacts, right? Like all the symptoms that you're experiencing. That's how we think about primary care, not a pure traffic control.
Yeah. But I think at the same time, I'm just, trying to think about also sometimes the challenge also come from the patient. I noticed that a lot of the time patients don't trust primary care because you're just primary care. I just want you to refer me to my eye doctor, my OB-GYN, my urology, because that seems
the specialist.
Right. And I think going back to our first conversation earlier before we started conversation about you're mentioning about the primary care, you know the patient very well, the relationship, less transactional. I think it comes both ways. The patient also view the meeting with the primary care as like, your goal is to tell me where to go.
Yeah, it is very unfortunate. I mean, that's why we're tackling primary care, right? The traditional healthcare system is very broken, and primary care oftentimes is like the punching bag, right? Like they're not reimbursed right. They don't have a lot of time with the patients. There's a lot of, like the traffic control, right? Like fundamentally the reimbursement structure just isn't right for what we need it to be. We needed to really build a relationship with the patients. We need the primary care provider to, when you come in, right, like use that moment, let's say I have UTI, you come in and see a primary care provider. We want the provider to use that moment to start to build a relationship with the patients. Because truth to be told, right, like if you're perfectly healthy, most people don't bother going to a doctor and to think about building a relationship. But when we think about primary care, it is using every opportunity possible to reinforce that relationship. And that's really lost in the traditional healthcare system, which is why we started Hello Alpha, right? Virtual primary care for women. That's what we do. Back to your question around sort of like sometimes it comes from the patient, right? The patient just want to be routed. They just want to get
because
to
you're like, gosh, you don't know what's going on anyway. I want somebody who's more expert in whatever XYZ. And the patient knows that those people, this specialty costs more. They have more schooling. So they think that they know better.
Yeah, I think there's a lot to unpack here. I think fundamentally, it needs to go back to a joint decision process, right? The way we practice primary care is a joint decision. It's a joint treatment plan. It's not just patient comes in, the doctor tells them XYZ, and off you go. That's transactional. In what we practice, right, we want the patient to feel like this is a joint decision. That you're part of creating this treatment plan for you. And through that interaction, the patient feel ownership in deciding how to get it treated, right? Whether it's UTI, whether it's birth control, whether it's weight loss, or something that requires a specialist. So that's lacking in the current healthcare system because of the reimbursement structure, because of the way it's practiced, right? Just like no time and no incentive to pull that out. So because that's lost, that's why patients oftentimes just, like, I don't trust you. I have no relationship with you. Get me to the specialist, which is really unfortunate because sometimes specialist is the right answer. But if you have a relationship with your primary care provider, your provider really should be your first line of defense. That person should help you, the patient, right, determine the right path of treatment. And overall, it will lower the overall cost of care when we route you to specialists at the right time. Just like thinking through utilization, right? Like when is the right time to see a specialist? Specialists, there's a long line of wait. Even primary care was like 26 day wait. Specialists could be 80 days of wait, right? How do we use the resources properly? We need to fix primary care and it elevates everybody else, including specialists. That's how we think about it.
I'm just trying to think about what you're just saying now, that the fact that the primary care, first of all, they are not compensated as well compared to the specialists. They're not reimbursed. Right. And I think because of that, sometimes it results backfiring in a way, like you're not good enough. That's why you're not being paid that highly, which I think it's an incorrect perception.
It's unfortunate.
But that's kind of what the reality is sometimes. And I think what you were saying, I think going back to what having built that relationship, that's when you get the trust. Oftentimes, it's hard to do when you want to have it scale. So tell me about how Alpha is doing it, because that's what you're trying to do, right? Build it to scale, and yet you still have that opportunity to build relationship.
Yeah, definitely. So maybe we can pull back a little bit and talk about what we do in a very, very simple term. We're virtual primary care for women. That's what we do. We're all virtual. It's broad spectrum, the most comprehensive primary care you can imagine. So anything under the sun, that if we can treat that for you virtually, we do that for you virtually. We specialize in women's health, meaning we employ our providers. So these are W-2 providers fully employed by us mostly, and we give them intensive training in women's health to fill the gap that we talk about in medical school, right? So that's what we do. We treat men as well, but smaller percentage. So that's what we do. And how we build this, and like I said, Christine, it's so complicated. I have an engineering background, so I tend to think through things as an engineer, problem solving, right? But a lot of what we do, it's heavy operations. We have to build out the infrastructure, the technology to support the dedicated relationship. Operationally, managing a workforce, we are live across all 50 states. We have to also manage like scheduling, licensing, right? Like to make sure that Christine, when you come in, every time when you come in, if possible, we want you to see your dedicated provider. But since we're virtual, right? People come in 24/7. Your provider is not going to be up 24/7. So just building out all of the infrastructure, both technology and operationally, to support this model virtually, it's fairly intense. But that's part of what's so important, right? That we want you, Christine, to get on a first name basis with Dr. Gloria. And that's that relationship we're talking about. In fact, we build out a lot of features here and there to help patients like put the control in their hands, right? For example, a couple of weeks ago, we launched a feature to allow patients to select, tell them that, hey, like your provider, Dr. Gloria, it's going to be out for the next 2 days. Do you want to wait for her or do you want to see someone immediately? So we give it to the patients to decide and then they can choose, right? So that's a lot about building the relationship, building trust, and also making sure that patients feel like they're in control of where this is going.
And going back to your saying earlier too, that our health system is in a way is broken or whatever, that is flawed. You're not changing the system. What you're trying to do is provide this platform or workplace for allowing the primary care to provide that relationship building with the patient. Why is the other system can't do that? Because you're not fixing the system. The system's still the same. How it's paid is still the same. But what is so special about? I mean, I don't want I guess the issue is that what's so special about yours that how come people cannot just do it?
Yeah. If we're working within the system, then you're still bound by CPT codes, bound by reimbursement structure, bound by how much you can get reimbursed through what modality of care, how many minutes you spend with the patients, like all of that, right? Is it billable? Is it not billable? All of that. And that would take a lot of lobbying, a lot to change how that's done. That's beyond my pay grade.
Right.
If we work within that infrastructure, right, our providers won't be able to practice the holistic care. They won't be able to do like all the things that we talk about, right? Like manage your physical health, your mental health, everything, because then they have to think about, like in a classic brick and mortar example, is this billable, blah, 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 stuff like that. That's why we're outside of the system. We're a cash pay model. So when you look at our business, we have a consumer business. That's how we got started. It's a very low cost cash pay model. We have 2 tiers of membership. The bottom tier is $29. There's no more. That's it. Like we don't bill your insurance. The top tier is $64. That includes literally everything you can imagine under the sun: chronic care management, remote patient monitoring, registered dietitians, everything. So that's the consumer model. Super affordable. We also have a B2B side of business where employers pay for a benefit to the employees. We also have a third B2B2C business as marketplaces. So that's how we build it out. And it's outside of the system, outside of the CPT code, like the usual way of how it's structured, because we couldn't reimagine how primary care is practiced in that framework.
I'm just thinking about what your model and being here at UCSF. I'm just thinking the answer would be like, are you crazy? You paying healthcare for $29 per month and you have access to all my primary care. How does it work?
We are very, very innovative, I would say. So we think about traditional telehealth. You have the video visits, right? That's traditional telehealth. And then subsequently, you could have things that's asynchronous, that's message-based, or like combination of modalities. That's how we practice. And we are, like, I'm a technologist by training, right? Like machine learning, data science, AI. So we have a lot of tech enablement in what we do. Fundamentally, we're tech-enabled services. And our technology enable our providers to practice at the top of their license, right? Like, Christine, before you even quote unquote see our providers, we capture all the data from you. So all of your medical information, social history, everything, we ask all of that before I even connect you with your dedicated provider. So we get to very, very efficient in what we do. And our providers are able to practice at the top of the license, right? Like, they're able to think through holistically what's happening. When you come in, say, for maybe weight management, they're able to see from all the medical intake you've done, not just about the number and scale, BMI, but they can also see, do you have eating disorder? How are you sleeping? Like things that are holistically related to the metabolic condition. They're able to do all of that because of the efficiency in the system.
I mean, is it possible because you start from ground up?
Ground zero.
compared to ground zero compared to, say, an institution like UCSF, like, okay, let's start, is because of the way the doctors is being compensated XYZ.
Sure.
My question then, how do you attract your physician to come join you?
Yeah, this is one of the great things about our mission. It really goes very far. So our mission is to provide affordable, accessible healthcare for all, specializing in women's health. When you think about our mission, it truly is about bringing affordability to patients who really need it, right? Like $29, $64, that's cheaper than a copay. And our mission really attracts a lot of providers who want to work for us. So part of this is that they get exposure, they get training in women's health, right? Because when they onboard, when they join us, we give them intensive training about 3 months in everything that we treat, including women's health. The other part is just the diversity, the sort of like what we practice and our mission really is attractive to providers. And when you think about what we practice, right? From a patient standpoint, they prefer telehealth. They prefer messaging a provider because of their convenience, right? Like you don't have to wear makeup. You don't have to schedule time. You don't have to find a private space for even a phone call, right? Like it could all be through messaging for most states. When you flip it around and think about for the provider, it also attracts different types of provider, right? Who wants that flexibility, who wants to be able to build a relationship with the patient, but through messaging, through different types of means that works with their own life as well.
I think there's a benefit of, with the mission, that, and so your physician, are they usually, this is kind of their side gig with W-2,
No.
or it's like 100% they don't do anything else?
Yeah, we're quite different. Majority of the visits are done by full-time W-2 providers that we employ. So majority of the providers we hire, this is their only job. And that's the difference, right? Like, because when you think about sort of like contrast what we do versus telehealth V1, more transactional, just like UTI, you never see the same doc again. What we do for the provider, some of them, they think this is more satisfying because you get to see the outcome of the patient. You get to track, like follow along with the patients, right? They also enjoy building a relationship with the patient. And they get to see like visit after visit, you getting better, right? So that's satisfaction that you typically don't get in a transactional model.
I mean, I really love what you're doing. And I think, our symposium last week, we were talking about there's a lot of shortages in healthcare labor, and we just need to work smarter. And does that mean you're just shifting the labor market? It used to be somewhere in the mainstream health system and now part of Hello Alpha, and then
I think there's a little bit of like shifting the supply to where the supply wants to be and shifting to where the demand is, right? Like, because when you think about this, like if we fast forward like 5 years, 10 years from now, I think about how my kids are going to consume healthcare. They're not going to try and Uber their way to a brick and mortar location. They're not even going to pick up the phone to call. They're going to just feel like how you order food, like you message, right? Like that's how you're going to interact with your healthcare system. That's your first line defense. So thinking through that's the demand, that's where the supply needs to be. And that's where we have the workforce, right? Like that's why providers want to work for a platform like us. It gives them the flexibility. It lets them build a relationship for those who care about a relationship, right? And truly, it is just like I think that's how healthcare is going to be practiced in the future. Like, I think one of the barriers of telehealth, I would say, is that historically, a lot of people still think that telehealth is the cheaper, faster, but inferior option to healthcare. We got to break that. That's not what we should be compared to, right? Like, yes, it could be cheaper. It's definitely much more efficient and convenient. It is not an inferior modality, right? It could deliver equal, if not better quality of care because it's just like standard, like everything's standardized through these types of communication, right? It doesn't matter what you look like, Christine or Gloria. Gloria, you look like a professional. I run out of time at the end of my visit. I'm not going to ask you about domestic violence. That's not standard care. So in this type of newer way of doing telehealth, I think that's the beauty of where you maintain a standard care across everything and where we can deliver equal, if not better care than in person.
Yeah. One of the things that, shifting a little bit on different topic, well, still the same topic, a few months ago, is it a few months ago now? A couple of months ago, maybe, I opened my app for my Amazon looking for my grocery shopping. And next to it is medical tab. So I click on a medical and Hello Alpha is there. So I was like, oh, this is really exciting. Maybe if you could tell us a little bit, I think it's really interesting time about the whole consumerization of healthcare. And I think sometimes being at university, we deal with, UCSF deal a lot with people who are really sick, who need really specialist care. I think that's what the amazing part about for being part of UCSF. But to see that now you can get medical care like I'm getting my grocery, and it's really kind of fascinating.
Yeah, it is. I would say it's liberating for some patients too. So when you think about healthcare in general, like we can't have a one size fit all. Sometimes even like for the same person, you need different things in different life stages, right? Sometimes when you're really sick, you need that in-person care, the same, like a giant care team. But in other times where you only really need a transaction, right? Like marketplaces like Amazon, it's a great way to get healthcare because it's fast, it's convenient access, and it's vetted, so you can see the data. It's in front of the consumer, right? I think that's a big part of why it's so difficult to consumerize healthcare because traditional healthcare system, the patients don't really see the data, right? But in the marketplace model, like Amazon Clinic, you see how fast we're responding. You see very transparently how much we charge, right? So those are important factors for consumers to determine for a quick healthcare transaction, who do I want to go? And I think that like showing the data to the consumer, allowing them to consume healthcare how they want, right? That's an important evolution.
How does it work? I mean, sure, I got the monthly membership to participate in Hello Alpha, but at some point you have to refer me to the specialist, and I still need the traditional insurance. So there's additional cost in a way for me, right?
Yeah. So for things that needs to be in person, we do that every day, like just in-person referrals. However, I would say the beauty of what we do is truly like having a trusted primary care provider that's on your fingertip. Like things like one of my frustrations with the classic healthcare system is the fact that oftentimes you might need a lab for certain things, right? And most healthcare systems would make you go in for in-person appointment just to get a lab order. Why didn't they make you come in? Because they can bill if you don't come in, right? It's very annoying to me that it is unnecessary. Not everybody have the means to take time away from work, have childcare, have the transportation, right, to go in. So that's one thing that I was always really frustrated about. In our model, we manage your labs, we manage your imaging like as much as we can, right? You can do all of that on your phone, and we do all of those for you. That said, if you do have to go in person, right, for certain things, let's say you need a whole body mole scan, we can't do that. We will make the referral alongside with all of your records to a in-person provider. And there you have to figure out whether you want to use if you have insurance, right, whether you want to use insurance or cash pay. So that's the model. But I would say for virtual primary care to truly be primary care for a person, you have to manage the labs, the imaging, like everything like pharmacy, right? And including referrals as well. That's just like part of primary care.
Right. It's really interesting what you're describing. I mean, I have so many friends who are in different system. They have a lot of, oftentimes the same thing. Oh my God, my doctor's like, he's retired. Now I cannot find a doctor. Can you find me a doctor? I'm thinking like, why do you need me to find you a doctor? I need to find a neurology, but that takes months. And can you, do you know somebody? And I'm thinking like, even though I'm a UCSF, I'm a Kaiser member. And a lot of the things that you describe, I have benefited from it. So the whole video thing, the whole texting, the whole sending information is not new.
like ordering labs, like they don't drag you into Kaiser is a very different. I have a lot of admiration for Kaiser, but it's a different payment model, right? Like it's a provider. It is typically not healthcare. It's practice. My own patient journey. I was at like Sutter Health, and the typical Sutter Health, right? Like it's a provider group with labs and with everything inside, and because of that, they saturated the market in the local Bay Area. So it's not like a Kaiser model where Kaiser truly it's capitated, right? Like they're not incentivized to bring you in just to bill. So that's like I said, I have a lot of admiration for that model.
It's so funny because sometimes when I have something, I would I would text email the doctor, and then they say, well, we can, you can come and we can take a look at you. I was like, no, I don't want to come. Can I just send you another picture? And then it's convenient. So I totally understand the convenience part of it, and which is interesting, from what we were saying earlier, being in Hong Kong is one system. And what you're saying that healthcare is, in a way, everybody wants to be special in a way that now there's so many different systems. So we are not going away from having fewer system. We're getting more system. And of course, as a country, they try to avoid the whole consolidation and everything too. So maybe that's the reality that we will live as part of living in a capitalist world, I guess. But I want to change a little bit, segue away from your company per se, but it's more thinking about your journey as a tech person doing the healthcare. What are the things that you learned from it that you did not know? That because there's a lot of sometimes people like to say, "Oh, you're such a tech person, you don't know how hard healthcare is."
Yeah,
and I always
I can
like to
attest
say,
to that.
yeah. Well, I think it's great to have people from different perspectives sometimes to see how to tackle things differently. But
I think I do think we need more tech people in healthcare, and we also need more healthcare people in health tech, right? I think that's important. Just like sort of cross-pollination and thinking through things from an outsider lens, I think it's important. That said, as a technologist coming into healthcare, I think the biggest shock I had was just like how difficult things are, how heavily regulated things are, and how much I have to spend on lawyers stuff. Like things like, like biology doesn't change across state lines, right? Yet, like we spend a lot of money on just like mapping out the 50 states, licensure, delivery mechanism, modality, how do you establish patient-provider relations, like all of that good stuff across all 50 states and multiply that. That is cost. That is time and cost that we don't otherwise use on anything else, right? So at the end of the day, we think about this, we are costing, the patients ultimately are paying for this, right? Like all the regulations, all of the things that I think make no sense that we have to spend time and spend money on. That's shocking to me as an engineer.
I think, what was the statistic? I think I heard is 1 in 17, right? After 16, that one care providers have 16 people behind them or something like that. I think that's what it is. But I think, oftentimes I also learned in life, there's no such thing as balance. You always tend, swing to the left, swing to the right. And regulation is there because people with good intention, and sometimes it went too far and just people become so focused on you need to follow the rule. You need to follow the rule and, forget what we're trying to do. But at the same time, oftentimes people who always, come from the healthcare look at the tech people. It's like the motto is like, build things fast and break things fast and move on. And it scares a hell a lot for the healthcare people. Like you break them, somebody die.
Yep. It is that like happy medium, right? Like we talk about, I mean, I grew up in tech, so like companies like LinkedIn, Google and whatnot. And we used to say in tech, like, what are, like move fast, break stuff, or, like you're assembling a plane, jumping down a cliff, right? Like that's very scary to healthcare people because you can't.
For a good reason.
Right? Like you're dealing with someone's health, like someone could die. So that, I think that the reaction from healthcare practitioners, it's correct. That said, I think we have to strike somewhere in the balance, right? Like you don't want to swing all the way to never breaking how we practice primary care, and we would be stuck with my own patient journey or worse stuff, right? Yet we're not moving so far that you're risking someone's life. There's got to be a medium, and I think it's a constant struggle, but I think it's a healthy struggle.
I think that's always the challenge you have. It's always keep moving the swing, you know. I'm sure you have to move a lot of mountain to get where you are. And maybe you can, I always like to maybe pick on a case study, maybe, you know, I'm sure people are just like, how does Gloria get to be listed in Amazon?
That is a fun story. They reached out. So it was an invite. But I'm sure it's because, one, like we've been around, like we didn't just like pop up out of nowhere, right? Like the company was started in 2017. We started seeing patients end of 2018, beginning of 2019. So we've been around and we've been pushing the boundary of asynchronous care. So we've been known for pushing the boundary, like really like trying to push how far we can go in affordability and accessibility in healthcare. So we've been doing that for a little while. And then Amazon reached out. Obviously, we went through a lot of diligence on both parties, right, to figure out whether it's the right fit, whether we can do this. And it's an interesting journey, I would say. But that's, I think that shows sort of like you have to remember as the founder, like, what's your mission, right? Like our mission is affordable, accessible primary care, and stay true to that. And you will, like, the right opportunity will come up.
And how do you advise other founders? I think we all, you know, we love to stay true to our mission. And sometimes it's not always easy when you're about to die, right? And, you know, just like somebody was telling me, like, you know, you're all not religious. And the moment you're about to die, you start praying to every God you know.
I know this is a hard balance. I mean, I think like at the end of the day, everybody, including a founder, have lots of options, right? You can choose to work wherever way you want. There's a reason why you do something that's so difficult. Like starting a company is not easy, right? In healthcare, it's even more complicated. There's a reason why you choose to do something so difficult. Is because of your mission, right? Because of something that you're trying to accomplish. That said, I oftentimes combine that sort of like the emotional side with my data science mind, which is you have to like constantly look at the market, like survey the land, figure out where the market is moving, and just figure out like where does your mission apply the best, right? Like, so you're not swaying away from your mission, but where is the right market? Where is the right fit? Like finding that product market fit. I think that's one of the biggest challenge as a founder. But you know, the fun about being a founder is that you get to see that from a 50,000 foot level and then execute on the ground.
And where's the best place for you to find that understanding where things are going from that? Because I think as a founder, I was talking to different founders the other day, you have to see things that is 3 feet level, but you also have to see things at 30,000 feet level. You almost like need to have progressive lens on your eyes.
Yeah, definitely. Being able to zoom up and zoom down is very important. And I think lots of great resources like these podcasts, right? Like these are very important. I was at LinkedIn. I used to work at LinkedIn. So professional network and the value of a professional network, it's ingrained, seared in my brain. So I have a great network where I talk to my network all the time and figure out things around the edges. I try to be helpful and they try to be helpful to me, right? So I think that you get a lot of market insight and you compile those data and figure out like how do you make your decisions there. So professional network, outside resources like podcasts and whatnot. And then like you have your board and other people that you talk to that can give you broader views, right? Because boards and investors, they tend to have multiple portfolio companies. And they can tell you, they're not competitors usually, but it can tell you like where the market's moving, what they're seeing, things like that. So I think all of those together, when you distill all that information together, that gives you a good view of how your market is moving and how your product is fitting in.
Mm-hmm. So last question, as you've done this journey, I'm sure there's a lot of ups and downs. I know you're true to your mission. But sometimes, even if you're true to your mission, you just got knocked down so down that you feel like, oh my gosh. And where do you draw the strength, your strength from and support from?
That is a great question. I think one thing that's really great about what we do, we're frontline healthcare, right? Because we treat patients. And I read every single one of our patient reviews, every single one. And that's the source of power. It's just really rewarding to see patients how they're using it, what they like, what they don't like, seeing their patient story. It is the biggest source of power to me and my team as well. Like, we all read every single one that comes in, like every day, a few times, right? Like different patient feedback, patient review. And that's where we draw our power. And also sometimes that's where we draw our product innovation. If you see your patients all wanting certain things, then makes you think about, well, like, are we meeting them where we need to meet them? And that is rewarding.
Mm-hmm. Well, thank you. Thanks for sharing your story.
Thank you, Christine, and thank you for having me on your podcast today.
Thank you for tuning into today's episode of the Health Technology Podcast. We hope you found the conversation insightful and inspiring. If you enjoyed this episode, please take a moment to subscribe, rate, and leave a review on your favorite podcast platform. Your feedback helps us continue bringing you the latest in health innovation. Stay connected with us on LinkedIn and Twitter for updates on upcoming episodes and more. Until next time, keep pushing the boundaries of what's possible in healthcare. I'm Christine Minato, and thank you for listening.